Okay, so what is this webinar about? So I'll start with this. This is I'm going to be describing how the actual source of my spasmodic torticollis was found. This was, believe it or not, a 40-year effort. It's very, very well hidden. One of the reasons I've spoken about this in the past in a number of occasions, but this is the first time we've had a webinar on this. I think we might be able to reach a lot of people if we keep doing this, and I know Justin is recording this, so that'll probably reach even more people. But one of the issues that I discovered in my own case of torticollis is that the trigger for it is extremely well hidden. And what was most interesting, at least in my case, and I hope this is true of many other cases, is that the treatment for it was remarkably simple. It was just simple day surgery that largely, not completely, but largely corrected the condition. I'll describe what that is. So this case is different from a lot of other cases. I don't think every case of spasmodic torticollis is caused by the same or similar things, but I suspect that there are a lot of cases either like mine very closely or similar in certain respects to mine and can be treated in similar ways. And I'm hoping we can find cases like this to open up new paths for treatment. All right. The key here is that in my case specifically, the underlying problem is very common, but it only creates, as far as I can tell, it only creates ST in a limited number of cases. It's pretty rare. I'll explain why in my presentation. But mostly what I want to know is I'm going to be going through in detail here about my case and how it was found and so forth. And I'm going to be doing it in detail, partly it's an interesting story, but mostly because I want you to think about your case and see if anything that I say rings any bells that seems familiar to your case. And if so, maybe we can chase something down in your case. So my agenda for the day, I'm going to give a little background on ST and cervical dystonia. I think most of you know what this is, so it's just one quick chart, but I want to go through this. Then I'll go into background on what my case of ST is and how I discovered it was ST. And then I want to talk about how I ended up using sensory tricks to locate the underlying cause of my ST. This is an effort that extended out over 9 years from the time I first discovered that sensory tricks were related, to ST, and if I could find one, then maybe I could use it. And it turned out that's how I found what the underlying cause was. And then I'll describe what the initial surgery was for my case, and then there's some follow-up treatments and discoveries that I have. And we've also allowed a lot of time here for my summary of what I've said, and then question and answer session too. So with that, we'll go on to just a very general background on ST. It is a neurological disorder, and it's not really well understood, but for some reason, the brain ends up commanding your neck muscles and shoulder muscles to go into spasm and create persistent contractions. And we don't know why the brain does this, but these persistent contractions, what they do is they pull the body into an unnatural and very often painful position. And one of the interesting things is that I find interesting is that you lose control over the muscles, and there's nothing you can do by your own force of will, your conscious force of will, to override what the brain is commanding your muscles to do. We don't know why you can't override those nervous signals. Fortunately, we've got a number of treatments that have been developed in medicine over the years. There are various pharmaceuticals that can relax muscles. Of course, we now have the huge breakthrough botulinum toxin injections that can block nerve signals that are causing the muscles to go into spasm. And more recently, we have deep brain stimulation surgery, which what it does is it implants electrodes at a particular spot in the brain. I'm not sure anybody fully understands what this does, but I believe what it does is it disrupts unwanted brain signals and suppresses the bad ones that are creating the muscle spasms. And so what I'm going to be talking about today is what other possible treatments might there be for at least some patients, all right? So I'm going to get into a little background, a little history of my case here. So my symptoms first appeared, I remember, in about 1965. I was still in high school. I had one muscle in my neck that would never fully relax. It was always had a little residual tension in it. It was very annoying, but it wasn't painful or disabling. At the time, as a high school student, I thought, well, maybe I pulled something in sports or did something like that, and that it would eventually go away, but it didn't. What happened was very, very gradually over the years, over the next decade plus, it got worse. I simply got used to it more than anything. I finished high school, then I went to college. I went to engineering school. I completed bachelor's and master's degrees in engineering, and I started my working career, and I was working for a few years. And then the ST really developed into a full-blown case in the 76, 77 timeframe, all right, a little over a decade after I first noted the symptoms. So now I've got a whole collection of muscles in the neck, the trapezius muscle in the back and the shoulder and everything, and are just pulling my head to the left like this. And it was affecting my left side body so much that I couldn't pull my left arm above about horizontal. I couldn't get it to rise vertically. The most I could do was get it about this level, and that was about it. The right side still worked just fine, but the left side was crazy. And I realized this was a serious problem. And there's one other feature of it that I want to emphasize right now, because this plays a huge role in getting to a solution. In addition to the muscle contractions in my neck and shoulder and upper back, I also had a neuropathic condition in my face, in my head. So what that was, I'd get all of these sensations developing all around the left side, upper left side of my face. These weren't induced by muscle spasms. These were purely neuropathic sensations. And they could become so intense, they would just be blistering painful, like a terrible headache or something. So at first I assumed it was a problem with headaches, but then as time went on and I gained experience, I realized that what was happening up here in my face was somehow correlated with what was happening in my muscles, and it was really, at root, all one problem. So all of this, I got a little timeline down here at the bottom of the chart so you can see. So that first red bullet was in 1965 when I first detected a muscle in contraction that wouldn't relieve itself. And then somewhere in the 76, 77 time frame when it really blew up and became a serious problem at that point. So if we move on now, I had a really good doctor at the time, and my primary care doctor, and he recognized that it was a neuromuscular condition and it was serious. He didn't know what it was. He put me in the hospital for 2 days because he wanted to run a barrage of tests that they had available to him back in the 70s. What he was looking for were things like a brain tumor or a stroke or a brain aneurysm, and then he ran a bunch of blood tests and ran a bunch of other tests that I don't even know what they were. He was trying to find something that could explain why my muscles were in this condition, and nothing, no test that he ran showed anything abnormal. All right. So then he referred me to a couple of neurologists, and I wish I could remember their names because they were both very, very prominent neurologists in the Los Angeles area working at the time. Neither one of them could identify what it was. And I point this out because even very highly skilled neurologists back then knew just about nothing about torticollis or cervical dystonia or whatever you want to call it. They knew nothing about it. This all predated, of course, botulinum toxins and deep brain stimulation. One of the great things about those two treatments, by the way, is that because they become so well known, a great many doctors now understand what dystonia is and spasmodic torticollis is, which makes it a lot easier and a lot faster to get to a diagnosis and to get to some kind of an effective treatment for it. All right. One of the great things that my doctor did at this time, since nothing could be found, was he sent me to a doctor, and I'll give you his name. He's long out of practice because he was late in his practice, even back in the 70s, but his name is David Rubin. He was one of the guys that was instrumental in the development of ultrasound treatment, interestingly enough, but he also specialized in patients that had very difficult to treat muscle conditions, which is one of the reasons why he got interested in ultrasound treatment. He couldn't diagnose my condition as ST or cervical dystonia either, but he told me he had seen my condition in a lot of his patients. So he knew what it was. And over the years, he developed muscle control techniques. And these were basically gentle stretching exercises, muscle relaxation techniques, and a whole collection of things that he taught me how to do. These techniques, since I've just found the NSTA many, many years later, these were all very similar to techniques that the French doctor Jean-Pierre Bleton has developed and that NSTA spreads around to patients to look into. We know it's very successful treatment to help you get at least some degree of muscle control back through muscle training exercises. So anyway, all the techniques that Dr. Rubin trained me, what I'd do is I'd go into his office once a week, spend about an hour in his office. He'd work with me and train me all of this stuff, make sure I understood it. He'd try to figure out what worked the best. So I did that for a couple of months, once a week. And then after that, I worked on his techniques for about the next year because I had nothing else to would work. And sure enough, it worked. And over the next year, I regained a lot of control over my muscles. So now I could move my heads and get my arm to move. I still had the condition. The spasmodic torticollis was still there. I just had it down to a level where it was somewhat less painful and I had a lot more mobility. So this truly saved my life, and I was able to continue with my engineering career and get on with my life. So let me talk a little bit about what muscles are involved. The ones that I have here involved, you can see in the diagram here, there's a whole collection of vertical muscles that run through the neck. And I don't know exactly which ones were involved, but almost certainly these vertical ones, the levator, several of the scalene muscles, there's 3 of them. I point out 2 here. The third one is deeper in the neck. And also the trapezius muscle was heavily involved back here on the back of the muscle, extending down into the shoulder, and also going into the back. And I also point out the sternocleidomastoid muscle here, this is the one that causes your head to twist. If your head twists to the left or to the right, the SCM muscle is heavily involved. And I know because this one was slightly spasmodic, it was also involved, but it wasn't powerful enough to twist my head. But I do point it out that it was there because I could tell the one on my left side was at least a little bit spasmodic. So anyway, it's not unusual for a whole collection of muscles to be involved in any case of spasmodic torticollis, which is one of the reasons why it's so difficult to treat. The doctor has to figure out which one of these muscles are involved, and if he's going to give you botulin toxins, he's got to figure out not only which muscles are involved, but where's the best place to inject. So this is a process that usually takes a lot of experimentation. So if you're trying to work with your doctor to get good results from your botulin toxin injections, don't be too upset if it doesn't work for a while, because it does take a long time to figure out all of this stuff. It's a tricky thing to do. So the big break that I had, though, was back here in 1975, and I had purchased a new computer, and it was the first one I had that had a CD-ROM drive in it. And the computer came with several CD-ROMs. And one of those CD-ROMs was a medical reference. So it contained a whole collection of reference material, nutrition, first aid, anatomy, and that kind of stuff. But the big thing was it had a database from the National Organization of Rare Diseases included on that CD-ROM. Hundreds of entries about all kinds of mostly terrible disorders. And I realized what I ought to do is go through this thing and see if I could find anything like what I had. And sure enough, I found descriptions of dystonia and spasmodic torticollis in there. And I was stunned. I says, this has got to be what I have, because it matched so closely to what I had. And what was interesting here was that each of these entries, like all the entries in the database, provided additional sources of information, places where you could go to get additional information. So this included, there's a section of the National Institutes of Health back in Washington where they actually cover movement disorders like dystonia, spasmodic torticollis, Parkinson's disease, and things like that. They also had a link to the Dystonia Medical Research Foundation, the DMRF, and the National Spasmodic Torticollis Association. So one of the things that I discovered with the National Spasmodic Torticollis Association was that the office was just a short drive from my home. And I thought, gee, that's great. I'll just go down there and meet all these people that have, and I can meet people who have the similar condition and learn about it. So I called up and I asked if they needed volunteers. And guess who answered? It was Justin Akinis. He answered. I explained to him that I probably had ST and I'd be willing to volunteer because I live close by. He welcomed me to the organization. That was over 20 years ago, and here we are today, still working with the organization, trying to do everything we can for everybody who has dystonia. It's just been a great organization. I've had a great time with it. So the thing I want to jump to next, because this is really important, I really want you people out there listening in to listen to this, because this is how I found the underlying trigger that was causing my ST, all right? So everything I got from all these organizations, the NSTA, the DMRF, the NIH, they all included descriptions of something called sensory tricks. And sensory tricks are a physical act that an ST patient can do that will spontaneously induce at least some relaxation of the muscle spasms, which is a great thing to have. The sensory trick will work as long as it's being done, and it stops working basically when the physical action ends, whatever that is. And there's quite a wide variety of them that people have found. So obviously I began to seek a sensory trick that worked on me. Most of the ones that I was able to find on the internet or read about didn't work, but eventually I actually found two that worked on me. One of the reasons I wanted to find them is because I mentioned to you that by training, I'm an engineer. One of the things I studied in college was feedback control systems, and that's been a big part of my career throughout my 50-year career as an engineer. So one of the things I recognized about sensory tricks is that that is a pathway to get into your neuromuscular control system and modify how it behaves, all right? And I figured if I could find sensory trick or two or whatever, I could study that trick, get into my control system and learn things about it, and maybe be able to do a better job as I learn more about it. And this is what led to my discovery of the root cause of my ST. And this is the time frame down here. So now we're talking about, I first learned about ST here, right, 97, 98 there arounds. And then I started looking for sensory tricks and working with them, overlapping from the late 90s into the early 2000s, all right? So I found two tricks, as I said, but they were very different. But what was interesting is they did exactly the same thing. They both induced both muscle relaxation in the muscles, not completely, but very nicely, and they simultaneously reduced the pain that I had from these neuropathic sensations in my face. So one trick was a little easier to do than the other one, so I trained myself to do that so I could do it throughout the day. And I'll give you a real quick description of what they were so you know. The first trick, I couldn't find a trick, physical trick, so I thought maybe there's some way I could trick my brain into doing something. I called it a cognitive trick. It turns out it was a physical trick, but I just didn't recognize it. What I did was I said, all of my problems are on the left side. What happens if I ignore as much as possible everything on the left side and just bring my concentration to the muscles that work on the right side and just focus on these muscles here? And the first time I tried that, I sat down in a chair, got really relaxed, and intentionally, as best I could, just ignored everything that's all the crazy stuff going on the left side, and zeroed in on the muscles on my right side. And amazingly, the muscles relaxed and the pain reduced, not completely, but significantly, very noticeably. And that was very noticeable. So that was a great thing. The problem with that trick was that it was hard to do. You had to really work at it to get that trick to work. The second trick was a little thing I did with my eyes. And I had learned years and years earlier that if I moved my eyes too quickly or too much, that I could trigger spasms, make them worse in my neck, and increase the pain in my head. So I had trained myself not to move my eyes. Both these tricks caused the same kind of spontaneous reaction on the left side, causing the muscles to relax and the pain to decrease. So I recognized that they might have something in common. So if I was doing these tricks for the next couple of years, and I was trying to figure out what they had in common. All right. And sure enough, I was able to figure out what they did have in common. What I was doing, both tricks caused a spontaneous relaxation in muscles in this part of the left side of my face. So all I had to do, keep my eye muscles relaxed and keep muscles in this part of my face very, very nicely relaxed. So this is something I could do all day long. It's very nice. So then I was thinking, how can I keep these muscles really relaxed all day long, as much as possible? And I decided, I gave a try. I said, what if I took a topical analgesic, the kind of thing you can go into the pharmacy or grocery store and buy over the counter, something like Aspercream. I could put a dab of this Aspercream on my finger and I'd rub it into my face like this, which deadens nerves a little bit, not much, but a little bit. And sure enough, that helped keep the muscles relaxed throughout the day, and it helped control the spasms. All right. Then over the next couple of years after that, I noticed something else. Sometimes when you rub this Aspercream in your face here, you get a little on the side of your nose. Now think about this. So, it's in the morning, I've got to go to work, I'm in a big rush. You get a little on the side of your nose, and what do? Well, you just rub it in, let it go off to work. Eventually, I noticed there was a very subtle effect. Every time I did that and applied a little of this topical analgesic to the left side of my nose, I had a little easier time controlling the muscles. All right, I found that to be very curious because there's no muscles here in the nose. So now keeping muscles relaxed here control the ST, deadening nerves on the side of the nose in a very, very small way, but eventually I realized also helped in a small way. So then I had an idea. I'm a curious engineer. I do these things all the time. I want to get into the control system and understand what's going on. So I said, okay, if putting topical analgesic on the left side of my nose helps, what happens if I put a little dab on my little finger and rub it inside my nose? All right. So I did that. That helped. I tried putting it on the right side. It had absolutely no help whatsoever. It was only on the left side where this helped. So I convinced myself that I got a tiny little bit of help by putting this topical analgesic inside the left side of my nose. And I said, all right, here's a Q-tip. How deep in my nose can I apply this topical analgesic? And will that help? So then I studied anatomy and made sure I could do this without harming myself. And I started putting this in my left nostril, going a little deeper and a little deeper and a little deeper. Finally, when I got in just about the length of a Q-tip, and you can see from here how deep you have to actually go, I got that deep in my nose, and the effect was dramatic. All right. So that's what this chart is. So what happened now is once I got to that depth inside my nose, applying topical analgesic, the effect was without question, it had a dramatic effect on the ST. Didn't make it go away completely, but it was by far the best treatment and control I had over my muscles in my neck and the facial pain up here. So this was in early 2006. I found this. So remember, I learned about sensory tricks back in 1997. It's now taken me 9 years to get to this point where I understand that putting topical analgesic in deep inside my left nostril passage controls my spasmodic torticollis, a very strange discovery. So now I want to go back to doctors and talk about this. So I saw my primary care doctor. This is a different doctor than I had before because the other doctor went into a specialized practice and left general practice, and now I had a new doctor. He had been my doctor for 17, 18 years at this point, so he knew me pretty well, and he knew I wasn't crazy. I could go to him with this kind of story, and he would take me seriously. So he listened to me, and he gave me a great suggestion. He said, go to an ear, nose, throat doctor and be inspected, have him or her inspect me for any anomalies in my nose. So I made an appointment with the doctor who was another doctor in my doctor's health group, extended health group. She was in a different office, much farther away, but from my doctor. But That was where they had the ear, nose, throat doctors. Her name was Julia Tian here in California, Southern California. I went into her office. This is an amazing story. I described what I had, dystonia, and I described what I had discovered using a Q-tip and putting it inside my nose and how it killed it off. She had never heard of dystonia or ST, never treated a patient that had anything like that, but she was familiar with patients who had facial pain, like I had. All right. And she knew that this facial pain could be caused if you have a nasal septum bone. That's one of the bones that separates your nasal passages. You have a left side and a right side passage. That's the bone that runs down the middle. She knew if that gets knocked off to one side or the other, it could pinch a nerve and create facial pain. So she looks up my nose and she says, your bone is off to the left. She says she's pretty sure from what you're doing with the topical analgesic that that nerve is damaged. All right. And she suggested surgery to realign that bone to get the pressure off that nerve to relieve the facial pain. She had no idea if it would do anything for the muscles. I had no idea if it would do anything for the muscles. So at that point, I said, well, I'm going to hold off on the surgery until I have figure out how to get an indication that the surgery won't make ST worse. I don't want to do that to make ST worse, even if it gets rid of the facial pain. Remember, this is elective surgery. I'm not in any rush to do it. It's as miserable as ST is. I wanted to make sure I understood what all the possible consequences could be. So let me describe to you in a little bit more detail what's going on here in the nose. This is a cross section of the nose. This blue stuff here is soft cartilage. I mentioned that. That's at the tip of the nose. And then this ethmoid bone, I was talking about that. This is a vertical extension of another bone that goes across the cranium inside here. This bone is pretty well fixed. But this bone down here, the vomer bone, it fits in here like a jigsaw puzzle. I think it's connected to the cartilage here, but along here at the base of the bone and along the ethmoid bone and along another bone back here, it's just pressed up against those bones, but it's not truly physically connected to them. So it can pop out of position. And this bone creates a lot of problems that ear, nose, throat doctors are very familiar with. Very often, if they slip off to the left or right, they can block the airflow passage in the nose, which is very annoying. And then ear, nose, throat doctors have learned how to go in there surgically, very simple surgery, realign the vomer bone, get it back into its position, and then you can breathe in both passages. But sometimes it can pinch a nerve. And way back here at the back end of the vomer bone up here, I've circled where this nerve comes in to the nasal passage, and there's a nerve called the nasopalatine nerve, and there's one on the left side of the vomer bone and one on the right side of the vomer bone that come down. They send out tendrils that go throughout the nasal area. Plus, they send a big trunk that goes through a little bone in the roof of the mouth. This is the hard palate that forms the roof of the mouth, and it just has sensory signals in the roof of the mouth. So this just touch sensory signals. So if you put your tongue against the roof of your mouth, you can feel your tongue. That's what that nerve does. It tells you that something is touching the roof of your mouth. But this nerve goes into the back, and it's believed that this is the nerve that gets pinched right here when the vomer bone is out of position. All right. Now, I told you I wanted you to, I'm going to tell you all the little details about my life here relating to this, because I want you to note whether anything relates to any experience you've had. Throughout my early life, from the time I was a child until I was in my mid-30s, I had recurring nose and throat bacterial type infections. It was repeatedly, many times. It was eventually solved, but I suspect that all of those nose and throat infections would get back in here, and if the nerve was damaged and irritated, some of those nose infections might have further damaged the nerve. So if you've had that problem, that might have also contributed to the problem as well. All right. So Let's go back on deciding on the nasal surgery. Wanted to find out, uh, convince myself that this surgery that Dr. Tian had recommended would work on the ST. All right. And so I thought, okay, she wants to take my vomer bone, which is off to the left, and put it back into position so it's centered right in the center of the nose like it should be. That would be a movement to the right. So I said, is there any way I can show that I can pull tissue to the left in the nose away from the vomer bone? Would that also relieve irritation on the nerve? All right, if that was true, if I could move tissue to the left, that would be the same thing as moving the bone to the right, then I would have an indication that moving the bone to the right would probably work. So I found 3 ways to do that. The first way was very simple. I would literally, everything is connected to everything in the body. So you've got tissue connects to everything. I just grabbed tissue in this part of my face. I pulled it to the left, and sure enough, I could slightly relieve the position of that nerve away from the vomer bone. And I thought, well, that's nice. That helped. I get the same effect as doing the sensory tricks. Then I said, can I do it even better? So then I put my little finger in my nose and I found a way to pull on my nose to the left, and that got it even better. So I said, well, that's great. Now I have these 2 tricks for relieving my nose that shows that the surgery would work. And then I said, but I don't want to go spend all day long pulling tissue to the left like this. That doesn't look good at work or in social situations. So I said, what else can I do? And I realized there's all these muscles in the face. Relaxing the muscles relieved pressure on the nerve, which is what led the way to finding this problem. Just that was my sensory trick, was relaxing these muscles. I said, can I train these muscles to pull tissue to the left? That's not a natural thing to do, but it turns out I can train the muscles in such a way that they will actually pull the tissue to the left and relieve pressure on the nerve deep inside the nasal passage, which sounds strange, but everything is connected to everything in here. That worked, and I trained the muscles to work. So now I had a little trick like that. That was the best trick of all, and I could do that all day long, and you couldn't even see me doing it because it's just the muscle trick underneath my face. Now I knew, I had a good solid indication that the surgery that Dr. Tian recommended would work, so I signed up for the surgery. All right. One thing I want to say here is that nobody should rush out and get this particular surgery because it's elective surgery. You should always know what you're doing and have good reasons to do it. So I don't recommend doing this unless you really know that the surgery would work, because I wouldn't want anybody to have surgery that might not work or could even backfire on their ST. So, but this did work on me. And by the way, I might add here, we know that this technology worked on at least 2 other patients. These were 2 patients who called into the NSTA hotline way back in the before 2010, and they were curious because they had nasal surgery to realign their vomer bone to open up their airflow passage. They had ST, and when they had that surgery, it greatly improved their ST. One of them I spoke to them by phone. I called them back and talked to them each. And one said that their ST was virtually cured. And the other one said that their ST was partially cured, like me. Didn't get a quite full cure, but a large reduction in the ST spasms and other problems that it caused. So we do know, at least in a very small number of cases, that this does work, but I still don't recommend you run out and do this unless you have a very good indication that it will work. Okay. So the nasal surgery was then performed in mid-2006. Remember, I first detected this problem, the bingo, was back in early 2006, and it took me until June to convince myself that this was the right thing to do. This was just day surgery. I checked in the morning. It was about a 4-hour time that I was at the day surgery clinic. You know, they check in, they wheel you in, they give you a full anesthesia, so you're completely out while they do the surgery. It takes them about an hour or so, hour and a quarter to do the surgery. Then they wheel you out. They put you in a recovery room where you wake up. And I always remember waking up and my spasms were, I could still feel them, but they were greatly reduced. The pains that I had in my face were all but gone. There was almost nothing there. It was astounding. It was just amazing. And furthermore, these conditions were easy to live with because they were so minor. Plus, the sensory tricks still worked. The nasal anesthetic deep inside my nostril, that still worked. Everything worked, so I was in great shape. Plus, since then, I found a couple of over-the-counter medications that also help. I'll be talking about those in a few slides too, so you have something you can test on yourself if you think you might have this condition and are looking for an indication that you might, all right? So let's go back to this figure here. I had shown this before and showed you which muscles were involved. But what's interesting here is that this nerve that I've been talking about is way up here, deep in the nostril, left nostril cavity, and it's a sensory nerve that's taking signals from the roof of the mouth and from around the nose and sending those sensory signals back into the brain, all right? And what comes out of the brain are nerve signals going to muscles that trigger these muscles and tell them to go into spasm. Taking care of this nerve shuts down these nerve signals, all right, which is a very strange thing. So this tells me that there's something going on in the brain between this damaged nerve here and the signals that come out of the brain here, all right? Somehow the brain is taking these damaged nerve signals, doing the wrong thing with them, and creating these signals going out to these muscles, all right? And I've referenced my background as an engineer, and I've mentioned how I have a background in feedback control systems, and I've spent 50 years working on systems that use feedback control systems. So believe me, once I saw this going on in my body, I said, this is a feedback control problem. What can I do to figure out what's going on here? And so I can explain it better to doctors or patients or anybody who wants to see it. So this is what I'm going to try to do. I'm going to try to explain how this works. So the brain is receiving corrupted nerve signals from this damaged sensory nerve and then does something wrong with them to create the spastic signals that go out to the muscles. So I'm going to have start off. This is a word chart. It's a lot of words. The next chart will show you what I say here in a graphic form, and I did it this way on purpose so that you can hear in words what I think is going on and then see it in a graph. And I think between the two, you should be able to understand what I'm talking about. This is all insight from my background as an engineer, all right? So think about it this way. Let's say how your feedback, your neuromuscular feedback control system works. Let's say you have some intention, conscious attention. You want to you're walking, you want to take a step. So you want to take one more step, all right? So what the brain is doing continuously is it's receiving information from all your sensory nerves. These are feedback signals from your body telling the brain what position your body is in, what the movement is, what's going on in your body, what your sense of balance is. Everything is going on into your brain. Your brain gets these sensory nerve signals. The brain knows which leg is to the front, which leg is to the back, which leg you want to swing forward in order to take a step, all right? And it takes this information, the signal information, and it compares what you want to do with what your legs are currently doing, all right? In engineering theory, that comparison between what you want to do and what your sensory information is providing to your brain, any slight difference, engineers call that an error signal. And a control system, the purpose of a control system is to drive that error signal as close to zero as you possibly can so that the system is always doing what you want it to do, all right? So the brain takes that error signal, which may be small. If the system is working properly, that error signal is small. It knows what you want to do, and it computes what your muscles have to do in order to do what you want to do and to keep that error signal really, really small. So now your muscles are commanded. Your left leg lifts up, it swings forward, and it sets down, and you've completed a step, and then you do it again. This goes on repeatedly. It goes on very smoothly as long as the system is working correctly. Your muscles are, in effect, your body's motors. They're doing what the brain is telling it to do. It's very analogous to an engineered control system. I want to point this out. If you're walking and you trip over something, all of a sudden that error signal that your brain gets, it becomes very, very large. All the information that your brain is getting is very different from what you want to do. Your brain recognizes that, and it recalculates what you need to do to regain your balance and take a step. All right. So this is why this concept of this error signal is really important. And I'm going to come back to this too, because I think this is what's going on, at least with some cases of spasmodic torticollis. The sensory tricks are doing something that gets you into this control system that allows you to discover what's going on within the control system. All right. And so the sensory tricks are really important. If you have sensory tricks, pay attention to them because they may give you clues about what's happening inside your body. Okay, here's the graph. All right. This is how engineers think about a control system. So your desire to do something, and here let's talk about your posture. You want to be comfortable. You want to be head, shoulders, comfortable position. Your head wanted to be upright. You want to have nice smooth motion. You want to turn your head. You want to control everything. You can do that provided your sensory information coming back from your body is correct. And then your brain is getting an error signal, which, because your brain is doing everything very, very quickly, that error signal is always very, very small. And your brain is always calculating what little adjustments to your muscle commands have to take place to keep you upright, balanced, comfortable, and doing whatever you want to do. Those muscle commands that the brain calculates, they go down as nerve signals and out to the muscles. So what you want to do is way over here. Your brain is receiving information from here, sending information back into your brain here, and you're coming out with these nerve signals here that go into the muscles that produce the movement that create and maintain your posture here. And then as your position might vary a little bit or a lot, that's sensory information that goes back into your brain. Everything works right. The brain works smoothly. Everything happens. The error signal that develops is always very, very small because the brain is very fast, keeps everything under control. But here's the point. What happens if there's an error, a big problem with this feedback signal that's going back into the brain? What if the sensory information is incorrect? Then the error signal is always wrong, just like it is when you trip over something. When you're walking, you suddenly get a bigger, and your brain does something suddenly different to try to get you. If you're walking, your brain does a good thing and tries to get you back into balance. If you have spasmodic torticollis and you get a corrupted signal, you get a brain signal, and now the brain does something wrong. It sends out the wrong signals to your through your nerves out to your muscles, and your posture changes. Your muscles go crazy trying to do what the brain is trying to tell it to do. All right, this is what's happening here in my case. So, all right, let's take a look at how treatments work from the point of view of this control system. All right, here we're talking about deep brain stimulation, and what they're doing is they're implanting electrodes deep inside the brain, and they're breaking up patterns that they've discovered at a location in the brain that are producing the wrong signals. And so the signals that come out of the brain that go out the nerves are much closer to what should be correct. This is why the deep brain stimulation works. All right, and then what comes out, now the system works very nicely because your posture is closer to correct, it's closer to what you want, the feedback signal is very good, and everything works very nicely. Botulinum toxins work a little different. You have nerve signals that are actually going into the muscles. And what the botulinum toxins do is they deaden the nerves to break up those nerve signals in the neck muscles, all right? And so what happens is those signals are weakened, and now the muscles and the other muscles surrounding them that might work a little better, now these work a little better. And again, your posture becomes more normal, maybe not perfect, but you're better off, and your sensory feedback is a little better, and everything works better, all right? I mentioned a couple of surgeries that used to be done. They're not often done anymore. One is they used to actually go in and attempt something called denervation surgery. It's analogous to the botulinum toxin in the sense that you're removing the signals that are going into the muscles to create the spasms. This is very rarely done now. Sometimes it is, but it's very rarely done now because it doesn't often work. And the botulinum toxin is not irreversible because you have to go back and get the shots every so often. But they can also experiment with this and with the botulinum toxins and do a better and better job as they learn more and more about where the best place is to inject. Whereas if the doctor makes a mistake with the denervation surgery, that's permanent. That's not a good thing. So they rarely do that, except in a few very, very limited cases that we've heard of where it is effective. Another thing they used to do is muscle severing surgery, where they actually cut muscles, and that's almost never done anymore either. That's a very dangerous thing to do because it's irreversible. But I suspect that every once in a while it can be done. I did hear about one case where it's done, but it's very, very rare. But what I want to get to here is that the surgery I had done is down here. Because this is all sensory information going into the brain, what I'm doing is correcting the sensory feedback that's going into the brain. All right, and I bring this sensory information back to what's more accurate and correct. As a result, this error signal is more correct. The brain that calculates what the muscles have to do is now operating on the correct error signal instead of a grossly incorrect error signal. And so the nerve signals that come through are much more correct. And then all of a sudden, I'm normal. All right, this is great. So let me show you in a little bit more detail what I think is going on here. Is that the nerve signals that were coming back from the damaged nerve are working at a subconscious level. I'm not aware of these damaged nerve signals, which I've shown in red here. The nerve signals that are coming through that nerve, the sensory nerve signals that are the correct nerve signals, were correct. I could not detect any problem. There was no pain, no irritation, no sensation coming from the site of the damage deep inside the nose. There was no sensation that was weird or strange coming from the sensory signals that were coming from that nerve at the point where they're actually creating the sensory nerve signals on the palate, on the roof of the mouth, or in the tissue in the nose. Those were coming through correctly. But the sensory nerve was sending subconscious signals back into this where the brain compares sensory signals to what you want to do. As a result, these signals were creating, I believe, this huge error signal that was creating all of the incorrect signals that are going through my system. So this surgery down here that you see that corrected my system reduced, or almost, not quite, but almost completely eliminated these erroneous signals here. All right. And now my system works much, much better. The reason this is so difficult to find, and that's the reason I drew this diagram this way, is because the correct signals went through. There was no way for me to actually pick up the damaged nerves signals that are going through. I still can't, even though they still go through at a much, much smaller level. If you can't go into your doctor and say, I got this crazy thing going on with my nerve here and it's causing my neck to go crazy, your doctor will never look there. It's in a strange place. All right. That nerve is sending signals into the brain. The brain does something wrong with it and sends signals to the neck muscles, which causes the neck muscles to go crazy and creates dystonia or spasmodic torticollis. This is a hard thing for doctors to diagnose. It's extremely difficult. All right. So I want to make a point here about something else that happened. I actually had a second surgery on this, and there's a reason why I want to talk about this. In 2015, I did have a second nasal surgery. As I mentioned, the first surgery didn't fully get rid of all the sensory problems that I had, or the muscle problems. They were greatly reduced, but not eliminated. I had become acquainted with another surgeon who I had seen him for other reasons. He had done a great job with me, and he was local. So instead of having to drive halfway across Los Angeles to get to Dr. Tian, I I could literally walk to his office, and he's affiliated with Long Beach Memorial Hospital here in Long Beach, where I live. And in fact, he's the head of the head and neck surgery department. So I went into him in 2015 and I described the condition that I had and I asked for his opinion. And he inspected me and he noticed that my sinuses on the left and right side, and there's several sinus passages from the nasal passages into the sinus volumes in your skull, they were all blocked, probably from those old infections that I had. And he ran a series of tests on me with some pharmaceuticals over the next 3 or 4 months, judged which had an effect on me and which didn't. And then he finally said, okay, what we really need to do here is do another day surgery and open up your sinus passages. And he said he was going to tweak my vomer bone a little bit. It had slipped slightly out of position. He didn't think it was a problem, but he wanted to put it back into position. He was going to clean out my sinus passages, drain over the accumulated fluids. Okay, so he did this. The surgery went great. And then he thought that by cleaning out all of this material, he knew from his experience that people who have problems with their sinuses often get headaches or facial pains or other nerve problems in their face. He thought it might have helped my spasmodic torticollis, just like Dr. Tian did. So he did the surgery. It was successfully done. There was no immediate effect. I couldn't tell anything that day, but sure enough, as the weeks went by, all of the residual muscle spasms that I have in my neck and all the little visual neuropathic problems and a little bit of facial pain that I had, all of that dissipated. So 6 months later, I had improved significantly to the point where I am at today. So he was right. He knew that when you have a nerve damage and other things that get in there that do crazy things and send the wrong signals into the brain, all of these things can contribute to whatever neurological problem you have. So that was a great insight that I have. So the positive results that I got from both surgeries, the first one and the second, they have both endured since they have occurred. The first one was back in 2006. The second surgery was back in 2015. And the results have been enduring the whole time. I still have very, very minor symptoms. They show up every day. But because I have these sensory tricks and I can use the topical analgesic and I have a couple of other tricks I can use, it is a very, very minor problem. And I hope we can find people who have these problems, get them diagnosed, and get them treated. And that's what I want to focus in on here for the rest of the presentation. Let me talk about one more thing about the facial pain. This is such an important part of my condition. Dr. Tian, the original ENT doctor, she knew exactly where to look. It was so fascinating to go into her office, explain what my problem was, and in 10 minutes, she knew what she had to do to fix the problem. And the reason why, this is interesting now, is that ear, nose, throat doctors often treat patients that have vomer bone out of position. I mentioned this earlier, that it's out of position and blocking their flow passage. And they've noticed that when they put it back into position, some of their patients who have neurological conditions, this clears up their neurological connection. So these doctors have a connection between that damaged nerve and problems that occur in and around the face and in the nose and whatever. So they connected that damaged nerve caused by the vomer bone with all of these problems. They have a connection. Doctors, neurologists that treat ST don't have that kind of experience or connection, because who in their right mind, a trained doctor, would think that because you have muscle spasms down here in your head and your neck or whatever, and it's doing all kinds of things down here, who would think to look 2 inches up your nose as the source of the problem? Nobody in their right mind would do that. But the ENT doctors, because of the nature of their work, are able to make that connection, all right? So one of the things that I've learned between what I learned from Dr. Tian and Dr. Tan and from the 2 patients that I mentioned earlier who partially or completely recovered from their ST from having surgery done on their nasal nerve, is that these 2 conditions, the facial pain and the neurological conditions in the face, and the spasmodic torticollis, they can occur separately, one or the other, or they can occur together. In my case, they're together. In the two cases that I described, the two patients that called into the NSTA office, trying to figure out why their ST went away when they had nasal surgery, they didn't have facial pain. They just had spasmodic torticollis, right? And the ENT doctors treat a lot of patients that have facial pain without spasmodic torticollis. So this is a very complex condition. You can get one condition or the other, or both, or whatever. So one of the interesting things I was going to mention here is that I learned something else last year. Like most of you probably, I got the COVID vaccination. I got it very early in 2021. I got the first shot in February, the second shot in March. It was the Moderna vaccine. And on the second shot, I woke up the day after the second shot, and all of my neuropathy on the left side of my face was back, but my spasmodic torticollis was completely unaffected. So the neuropathy didn't rise quite to the level of pain, as annoying as it was. It went on 24 hours a day, every day for 5 months, and before it finally faded away. But then I realized, here again, here's an example, because of these conditions with the brain and the nasal nerve and whatever triggers it, you can get one condition triggered or the other, or both, or there may even be other conditions that I haven't identified yet that relate to these neuropathic conditions. So I point that out just to make sure you understand these neurological conditions are very, very complex. There's a lot to be learned about them. And I'd like to find some patients that have conditions similar to mine. We can get the word out to neurologists, hopefully, and have them start looking for things like this, along with the things that they already know about, okay? So I mentioned that here the ST can occur independent of facial pain. We know that because of the two patients that I mentioned. We know that these corrupted nerve signals can excite at least two different parts in the brain. One part generates in the neuropathic conditions in the face, other part will trigger dystonic muscles in the neck. So those are two different parts of the brain that are being excited. One part might get excited, or the other part of the brain might get excited. But how this occurs, past getting corrupted signals going into the brain, how this passes through the brain is completely misunderstood. I don't think anybody understands it yet. So it probably depends on many, many conditions related to the patient, your genetics, your age, other health conditions you have. My ST initially wasn't very severe, and there wasn't any facial pain until the ST got much more severe. So there was nothing to connect the two at all for until I understood that the two were connected. But there's a lot going on in the neurology. And so don't get upset with your doctors if they can't figure this out on their own, because it's tricky. Now, I wanted to mention we at the NSTA know and work with a couple of dentists that specialize in treatment of temporomandibular joint disorders, all right? And the reason why this is interesting to me is that they're treating problems that patients have with TMJ, and they've discovered that with disorders in the TMJ, they end up treating problems with pain, with muscle disorders, and they even treat some patients that have spasmodic torticollis or other forms of dystonia, for example. And what I think they're doing is they're doing something analogous to what I'm doing here with my damaged nasal nerve. It's a sensory nerve sending signals into the brain, as I've described. What they are probably doing in some of their cases, this is my best guess, is that as they treat the TMJ, they may be relieving sensory nerves that are pinched or irritated in the temporal mandibular joint, which reduces the corrupted nerve signals that go into the brain and creates these various problems that they have. So I'm going to mention two of them that we know by name. One is named Gary Demerjian. He's here in Southern California. He has two offices, one in Burbank and the other out in Glendale, California. And the other one is back on the East Coast, Anthony Sims. He works out of Columbia, Maryland, if you're interested in them. Take note of their names, or we're going to post all of this information on our website. So if you don't get their names here, you can look them up on Google, on the internet. Their names will come up right away. You can find the contact information, a phone number, an email address. All that stuff is readily available via the internet. But these are great guys. We love working with them. They're very knowledgeable, and they're very successful at treating TMJ disorders. If you think you might have a TMJ disorder and you're anywhere as close to these guys, you could go into them and consult with them. If you're not in these areas, obviously many of you aren't, you can contact one or the other, and they might be able to find a TMJ specialist who you're close to that you could consult with. So I endorse working with these guys one way or the other if you think you might have a TMJ disorder, because we've seen the results of the work that they do, and it's very positive. So, okay, so I want to talk about what you can do to test if you have a condition specifically like mine. All right, and I'm going to make a point here. I'm not a doctor. I'm a patient. I have no medical training whatsoever. I just have my personal observations that I've collected over the years that I've described to you here. The advice that I give you, take everything with a grain of salt. And before you try anything on you that might be potentially risky, check with your doctor. Make sure that any supplements that I'm going to suggest here, even the readily available OTC stuff, make sure that with your doctor that nothing will affect you adversely. I don't expect it to, but it's always a wise idea to do that. One thing you can do is check physical tests on yourself. Now, I mentioned sensory tricks. It's a hard thing to connect the sensory trick with some underlying problem like I had. Remember, I told you from the time I first learned about sensory tricks to the time I found sensory tricks, to all the things that I learned about what was happening, to the time I discovered what was really going on. That was a 9-year period of study. So I don't expect this to be easy. But if you have a sensory trick or two, pay attention to what's going on. And if you do have one and you think you might have something, feel free to contact me. I'll give you whatever advice I can think of. Maybe we can find some other damaged nerve that you're mysteriously relieving through a sensory trick. You're getting into your control system in some way that's relieving some irritated nerve that's triggering your ST. But here's something else that we can do. I mentioned the over-the-counter topical analgesic. Using a Q-tip isn't particularly difficult to do. You do have to be a little careful, and I'll point out that Q-tips of one sort or another are used in COVID tests. I've had a couple of COVID tests myself where they give you a Q-tip, you stick it up your noses, you swab it around, you get all kinds of mucus collected on the swab, and then you use that to determine if there's any viruses on it. So that's pretty much what you'd be doing with a Q-tip. Just be careful with it. Put a little dab of analgesic on it and swab it around in your left side or your right side and see what happens. If you get a response and your ST calms down, try to figure out if it's one side of your nose or the other side. That would be a good indication that you have a condition just like mine. Contact me, we can talk about it. Then we'll see if we can find an ear, nose, throat doctor who can inspect you and see if they can figure out if you have a condition that might be worth doing something on, all right? And go from there. Don't rush into it, because I highly recommend not doing surgery unless you know exactly what you're doing it for, all right? Let me jump to another thing here. There's 2 over-the-counter nasal sprays that I've discovered that work on my left nostril that will also suppress the neurological conditions. I'll show you what they are, and I don't know why exactly they work. I have a couple of theories about why they might work, but I don't know exactly. So the nasal sprays, one is called nasal crom, and the other is called nasacort. And the way these work is these are allergy nasal sprays. If you're exposed to an allergen that causes your tissue in your nose to puff up and you generate a lot of mucus that swells up your nose and plugs up your nose, what these sprays will do is they go in there and they go act on your nerves that go into your cells that release histamine molecules. What the histamine molecules do is they cause your tissue to puff up, they swell up, they cause your tissue to release a lot of fluids, mucus and other fluids, to literally block up your nose and to collect the antigens and keep them from going deeper into your body. That's why their system works. Antihistamines block, these antihistamine sprays actually block your system from releasing the histamines. There are other medications known as antihistamines, Benadryl, for example. What they do is they block the histamine molecules from functioning after they've been released. What these medications do is they block the histamine molecules from being released, and they work one of two ways. Since these work on your nerves, preventing the histamine molecules from being released, one theory is that they may also prevent some of the corrupted signals from going back into your brain because they're shutting down your nerve. Now, I don't know if that's what it's doing, but the other possibility is because you've got this damaged nerve, your immune system may detect that it's irritated and it may release a few histamine molecules that cause tissue to swell up around that injured nerve. That would increase pressure on the nerve. That may further irritate the nerve and create more signals that go into the brain. By blocking the histamine molecules, the tissue would shrink, the pressure on the nerve would shrink, and the signals going into your brain would be reduced because your nose wouldn't be, the nerve in your nose wouldn't be as irritated. There's two theories. They both might be true. They both might be wrong. One or the other might be right. Who knows? I don't know. But if you want to try these, they cost about 20 bucks if you can afford that, and give it a try. If it works, definitely contact me. I'll have my email at the end of this presentation, and then we can begin to figure out what to do from there forward. All right. So the other thing I have for you is a bit more strange, and this is something I discovered way back in the mid-1990s before I even discovered ST or dystonia from the NORD rare disease database. And like many of you probably have done, is that all the years that I had ST, I would try to, since nobody could treat it except for the exercises that I had, I kept looking for something that might have an effect on it. So I tried vitamins and minerals and things like that. Nothing ever worked. One day, it was around 1995, I was at the grocery store one day and I walked past the vitamins and minerals counter where they had the rack of all that stuff. And I stopped and I said, is there anything here that I haven't tried? And spending a minute, I discovered there was something called vitamin B12 in a timed release formulation, something I had never tried. I'd never seen it before. So I figured, what the heck, it was $5 a bottle back then. I bought a bottle and I said, this probably won't work like everything else, but it'll drive me crazy if I don't try it. So I bought a little bottle. I took a pill when I got home, tried it, and to my amazement, half an hour later, my muscles had relaxed noticeably. My pain had gone down noticeably. And I discovered every time I took this, that would happen. And it worked then. It's worked every time I've taken it. It still works. Even though I hardly have any ST, it still works today. I still use it if I get a little irritated. Sometimes I'll take a small dose of this and it still works today. I have no idea how it works. It's not specific, I don't think, to my nasal nerve. If you want to try something to see if you get anything that might ease your spasms, you might try this. A small bottle of timed release vitamin B12 costs 12, 15 bucks in the pharmacy or grocery store. They come in very, very large doses because what the pills do, because they're timed release, they just very slowly trickle vitamin B12 into your body and they elevate the level of vitamin B12 in your body. Whatever it's doing, I don't know, but they're there because apparently a lot of people find some benefit in this one way or another. This is the benefit I found. I have no idea if this works on anybody else because I haven't found anybody yet that works on that this works on. But if any of you try it and you find it does work, I would really like to know that this works, and then we can maybe get the word out to other people and maybe it'll give us a clue how it works. But again, like I say, check with your doctor before you try pharmaceuticals, even if they're over-the-counter stuff, because who knows what effect it might have on your body. This is supposed to be pretty harmless stuff. It's never had a bad effect on me, but I always advise checking with your doctor before you try anything new like this, a pharmaceutical. Okay, so getting close to the end here. What I've learned is that it's possible for damaged sensory nerves to cause dystonia. In my case, and in a couple of other cases that we've heard about, that can cause a problem with my problem, damaged nasal nerve. Plus, we know about a few cases from the TMJ dentists who probably are treating damaged sensory nerves in the TMJ to attenuate problems in their body. The sensory tricks that are causing these problems, all right, I'm sorry, the nerves that are causing these problems can be relieved by sensory tricks, but the sensory tricks don't always lead you directly to what the problem is. It's kind of a tricky thing to find out. So if you have a sensory trick that works, consider the possibility that it's doing something that's relieving a sensory nerve somewhere in your body. See if you can figure out where that might be, all right? It's a very interesting thing to get as much information on this. The damaged sensory nerves themselves probably aren't even apparent to the patient. They're operating at a subconscious level, as I mentioned. They may be physically very well removed from where the dystonic muscles are because the brain doesn't care about where the signals are coming from. If it's misusing the signals, it can create all kinds of chaotic signals somewhere else in the body. And you may have corollary effects along with the muscles. You may get facial pain. There may be other effects that we haven't identified. Who knows? There may be other muscle spasms. There may be other quirky things that are going on somewhere. So there's corollary effects that may happen. There may be no corollary effects. The physical effects of these damaged sensory nerves are probably well removed from the dystonic muscles, explaining why neurologists haven't identified them, because it's hard to connect a well-hidden damaged nerve from these muscle problems. But these are all things you can look for. So as I said, highly skilled doctors will have difficulty finding and treating these conditions when they're well hidden. Remember, from the first time I detected spastic muscles to the time I located where that damaged nerve was a little over 40 years. It was not easy to find. So it's a hidden damaged nerve. Don't blame it on doctors. Don't blame it on yourself. It's a very, very hard thing to find. And this nerve damage, I'm not expecting everything is going to be easy to treat. Mine was pretty easy to treat with a fairly simple surgery, day surgery. You go in, get it treated, come out at the end of the day, it's fine. It's no difficulty getting it treated. The one that I wanted to mention here, just to point out that there are things that I'm suspicious of, is that I keep reading about this thing. It's called trigeminal neuralgia. And one of the reasons I'm interested in this is that the nerve in my nose is one of the nerves that branches off from the trigeminal nerve. There are 3 nerves that come out of the brainstem that go into the face. They don't go down the spinal column. They come right out of the brainstem and go into the face. There's 3 on the left, 3 on the right. The middle one is called the trigeminal nerve. And way back here, deep somewhere underneath the cranium, sometimes that trigeminal nerve gets pressed up against the bone in the face on the inside of the cranium and gets irritated. And when that happens, neurologists have discovered that can cause head and facial pain like I had. Turns out they've made that connection, and they have a surgery for it. They go in underneath the ear, back here behind the TMJ, and they get in behind your cranium. And what they do is amazing. They get into where the trigeminal nerve is pressed up against the bone that's irritating it, and they put in a little piece of soft, low friction material. I think it's a kind of Teflon between the nerve and the bone. So now the nerve is up against something that's smooth and soft and has very little friction, and that usually relieves trigeminal neuralgia, so the pain in the face goes away. So I keep reading about this. They've never, to my knowledge, just connected the trigeminal nerve to ST, but I would be suspicious that I wouldn't be surprised if some cases of ST are caused by the trigeminal neuralgia. And I'd like to find cases of these nasal nerves causing dystonia to draw attention to the possibility that there may be other cases of trigeminal neuralgia that cause dystonia without causing facial pain. Remember, the facial pain, the dystonia, they can occur together, they can occur separately. It's a hard thing to diagnose. So I suspect that this and maybe many other things can be going on. There's a lot to be learned about this based on what I've seen just in my condition and the few cases that I've learned about that are similar in some respect or another. So, okay, that's it. I want to thank Justin Aquino. This is his idea. He asked me to pull this together, and I was really happy to do this. I figured we could get to a large audience. Let us know what you think. We're going to have a question and answer session here coming up, and let us know if you can offer any ideas on improvements for this performance. I want to offer great thanks to Justin, Vitran, Diane Truong, and many others for keeping the NSTA alive and well over all the years. These have been trying times for all of us. This has been just great. And this last chart, you might want to make a note of these if you want to email me. It's a quick way to get in touch with me. kprice4000@aol.com is my email address. And the NSTA, if you want to get in touch with Justin or somebody at NSTA, and you can write to him or us or both of us and send us your notes. Let us know anything you want to say to us, good or bad or indifferent, or if you have a good question, that's great. We're interested in hearing everything you have to say about this. That would be terrific. So with that, we're going to open this up to questions.
All right, what I'm going to do first, for the email address of the NSTA, it is actually info@torticollis.org, O-R-G.
Okay, I'm sorry, I miswrote that. I mistyped that. Thank you.
So just in case, that's our new email address.
I'll correct that.
Yeah, it's just the same as our website address, www.torticollis.org, but this is info@torticollis.org. So if you want to email the office, that is the correct email address. So what I'd like to do is a little housekeeping in terms of how we are going to move forward with the question and answers. If you look at the bottom of your screen, you will see a raise hand. And what will happen is as you click on that, it'll keep it in order according to who raises their hand first. What will happen is I will allow you to speak. You don't have to turn on your camera, but what will happen is when I allow you to speak, you'll have to turn on your microphone. And there's an option where I will ask you to unmute your microphone and you can ask your questions. In the what we'd like you to do is keep your questions precise, up to 1 or 2 questions, as we'd like to be able to answer everyone. If you do not have the ability to use your microphone, you can use the Q&A and type the questions in, which I see someone has already done so. So we'll start out with the typed in questions, one from Tracy Kelly. There's actually 2 questions for you, Ken. I don't know if you see that there on your screen. Do you see that, Ken?
Yeah, let me see what we
Okay,
got.
why don't you read the questions and then proceed with the answers for those.
Okay, so the first question is to Tracy Kelly. She asks, what's the difference between timed release B12 and regular B12 capsule or tablets? The difference is the timed release is designed to trickle the vitamin B12 into your body over an extended time period, whereas regular B12 capsules or tablets or whatever, that gets basically flooded into your body all at once. The problem here, as I understand it, is that the body on its own, your human body, limits the amount of B12 that you can have in your body at any given time. So if you take a regular B12 capsule and flood your body with it, your body will reject the excess fairly quickly, okay? With the timed release, by trickling the B12 in, it keeps sustaining a higher level of B12 into your body, even though your body is flushing out the excess because it's trickling the B12 in continuously over an extended time period. It maintains a higher level of B12 than you can get through the regular stuff. That's why it works. All right. Does that answer your question?
That is definitely it. And there's also another question she has, which is,
Oh,
which brand of B12 do you use?
actually, I'd have to go dig it out, but actually, I've used several brands, and basically, the B12, they all work as near as I can tell. I've used them since the mid 1990s, and different brands, and literally every one that I have ever used works. So just go to your, whether it's Walgreens or CVS or Rite Aid or wherever you go, a pharmacy, you'll find something there. You can find it in your grocery store. Just find the cheapest bottle you can find and give it a try. It should cost, from what I've seen, they typically run, the smallest bottles nowadays run 12 to 15 bucks. If you can afford that on a wild experiment that I can't guarantee will do anything for you, I apologize. But if you want to give it a try, just find a reputable brand that is sold in your pharmacy, and that should work as it does on me. Okay.
Okay.
Let's see, now let's Bethany Bilbray, did I pronounce that correctly? Has anyone at NSTA seen a connection between Lyme disease and ST? After 6 years of ST, I was diagnosed with chronic Lyme disease. Lyme treatment with antibiotics improved my ST muscle pain almost completely. That's very interesting. And lessened my turn and tremors. I've never heard of anything about a connection. Have you, Justin or V or anybody?
Not, no, not recently. I do remember, and this was probably over 10 years, almost 15 years ago. I do recall talking to a person on the 1-800 line who asked me the same question because they felt that their ST occurred after contracting Lyme disease. But other than that, no, I haven't. I haven't had any recent, information in regards to the correlation or even with treatments with Lyme disease helping ST symptoms.
Okay.
In terms of B12, there's a question here from Stacy DeSalvo. She asked, like, in terms of dosages, did you cover dosages, Ken?
Yeah, I didn't mention doses. The dosages in the time release pills are quite large. They're far larger than your recommended daily dose that the government recommends. All right. The reason it's so large is because it's trickling the vitamin B12 into your body continuously as it works its way through your intestines, and it gets picked up and digested into your body. But your body is simultaneously recognizes that you have a higher level dose than your body thinks you should have, so it flushes the excess out. So the dosage you actually get is quite large, but you don't get the full dosage all at once. You just get enough of a dosage as it trickles into your system to maintain, so that your body maintains a higher level dose than you normally get. I don't know what effect that it has on your body, but apparently enough people find some benefit from this that they actually sell it. And I know it has a beneficial effect on my ST. I have no idea how it works. One suspicion that I have, which I can't guarantee is what it does, is that it may produce a better balance of biochemicals in the brain and produce a better brain response than you normally get with ordinary levels of vitamin B12. So I don't know. That's not a very good answer because I have no idea what it's actually doing. That's just one suspicion. So what I do, one thing I do is, since my ST is in very good shape right now, I don't take the large dose. I just take the capsules that I get, and I dice them up into much, much smaller doses. So I break them up into, I think I break them up into about 6 separate doses from each capsule, and I take 1 or 2 a day if I feel I need it. So I don't take it every day. I don't take large doses. But when I did take much larger doses, it never had a negative effect on me. It only had a beneficial effect. I personally never had a negative effect from it. So if that helps. But if you're concerned about it, I would say buy the dosage and break the pill up into small pieces and start with small doses and see what the effect might be. So that's the best answer I can give you. And this is one of the reasons why I suggest, if you have a chance, talk about it with your doctor before you go out and take a large dose of a pharmaceutical like this. Okay. So I think Tracy Kelly had a similar question, what daily dose of vitamin B12? And like I say, I take these days, I take far less than a one time per day because I break the doses up into much smaller doses and I don't necessarily take it every day. Even when I was taking it at much larger doses, I still took it at much less than the dose of a single capsule, and I still got a beneficial effect. So if you start taking it, I would suggest starting it at a low dose, break up the pills to a much smaller dose, see if it has a beneficial effect, and then check with your doctor, see if it's okay to take a larger dose, and see if there's some dose that does have a beneficial effect. If it doesn't, it doesn't. I can't guarantee you will see an effect, but just be careful when you take it. I know I get a beneficial effect from it, and I hope other people do in some respect. So,
Next question will be from Bethany Bilbrain.
okay, do I advise you see an ENT to check for these bones out of place just in case? If you see an ENT normally and they're always checking up your nose, or maybe your regular doctor does, and they don't see anything out of the ordinary, it might be an indication that it isn't your problem. I would say it might, depending on how much it costs you to have a cost on your whatever your healthcare plan is to see an ENT. If it's cheaper to buy one of those nasal sprays, the nasal cram or the Nasacort, if that's cheaper, $20, try that first and see what happens. If you get a positive response from that, then definitely go see your ENT and see what they say about it. And then maybe they'll try applying topical analgesic deep inside your nose and see if you get a positive response from that, which might indicate that one way or another you have a damaged nerve somewhere deep in your nose caused by something that the ENT wouldn't immediately notice when they look up your nose. So there's different paths you can take on this. Check yourself first or go to an ENT. I recommend doing whatever is cheapest and as long as it's safe to do. So, okay, Beverly has another question here. She says, did I ever have a head tremor? And okay, no, one of the things I never had was a tremor. I had very persistent spasms that were pulling me to the left. The only thing I could do, that early doctor that taught me the exercises, he recommended gently pulling like this to get the muscles to stretch out and relax. And I found a lot of different exercises like this. And eventually I got it to the point where I could actually use the muscles on my right side and other muscles on my back and lower left to do that exercise, to keep the muscles stretched, gently stretched, not forcefully stretched, but gently stretched. And that would induce the muscles to relax. One of the things I now understand was one of the things that exercise was doing was, as I pointed out, everything's connected to everything. I now know when I do this kind of an exercise, it pulls tissue to the left. I was actually relieving pressure on that nerve by doing these stretching exercises. So in addition to whatever effect the exercises had on the nerves and the muscles themselves, I was also helping out by relieving pressure through indirect action. All of this tissue was being pulled along with my stretching exercises in a way that relieved pressure on the nerve in my nasal region.
It's a follow-up to that. Did the nasal surgery? Well, if you didn't have tremor, then it didn't.
Yeah, no, I didn't have a tremor.
Yeah,
so yeah, I don't know about that.
But here's another question
Yeah.
that's being asked. Does anyone else see a daily pattern in their ST? Did you see a daily pattern in your ST, Ken?
I would see it go up and down during the day. During the day, um, I can't say there was a distinct pattern. I suspect it was related to, even before I discovered all these things about what was causing it and how to treat it, I suspect it would very much depended on how irritated that nerve became. If I was under stress and I was, working on something that things would get worse. Uh, but that could occur anytime during the day.
Mhm.
So yeah, there was no distinct pattern, but I knew that the ST could get better or worse during the day, depending on how much under stress I was or how rapidly I moved my eyes and things like that. So I also knew, for example, sleeping at night, if I slept on my left side, so I had my left side on the pillow, that presses tissue in the face, which would increase pressure on the nerve. I didn't understand that at the time. So what I ended up doing was training myself not to sleep on my left side. I eventually got myself never to sleep on the left side. I only slept on my back or on my right side. And that was a cyclical thing. You could think of it as a cyclical thing, a pattern, but it was caused by this distinct pattern of applying pressure on the nasal nerve.
Yeah, I think in terms of patterns for the people that V and I have spoken to throughout the 2 decades we've been involved, one would be that I've heard a lot of people mention that when they wake up in the morning after sleeping, their symptoms were a lot less. And then as they began their day, it actually gradually got worse and more severe, which was interesting. And it would be anywhere between, like 10 minutes to 30 minutes, and then they would see it kind of press on. I don't know if it had anything to do with the fact that they were relaxed during the time they were asleep or something like that. And of course, in terms of patterns, the one that's most common has to do with stress and that exacerbating symptoms for people who have cervical dystonia. That when you're in a high tension situation, or of course, it could be anything that could be stressful from something from your daily life or whatnot can exacerbate your symptoms. But those are the two main things that I'm aware of with the people that I've spoken to throughout the years. Let's
Yeah,
see.
it may be, when I've many ST patients wake up in the morning with little to no problem, and then the problem develops throughout the day, and by late morning, thereabouts, their ST is fully back. So that suggests if they have a sensory nerve problem like mine, that somehow when they're asleep and they're relaxed, whatever nerve that might be is not irritated very much overnight. But after they get up and they start moving around, maybe their whatever movements they have during the day does irritate the nerve and does start sending signals into the brain that does start triggering the ST. So that may be a true cyclical feature, but it's related, would be related to triggering a sensory nerve during the day when you're active and relieving that nerve at night when you're inactive and asleep. So that is a possibility. I hadn't thought about that before, but that's a very good point.
I just wanted to add too, for those who the information that you were giving in regards to the TMJ and how it can help some people who have problems with their trigenital nerves or jaw joint relieve their ST symptoms, that there is actually a test that Gary Demergen and also Dr. Anthony Sims does that's very simple. And if you do see a specialist that does concentrate on basically treating TMJ, they can do that with the tongue depressors. Am I correct? The tongue depressors, where they adjust the jaw joint that is believed to be pressing down on one of the TMJ muscle or nerves, causing the ST symptoms. We've had when they were present at our symposium years past, and that was in Las Vegas. We had them work together and test people just to see if they would react to a TMJ, a jaw joint adjustment. And of course, some people did and some people didn't. But the interesting thing about it is that if you do react to it, you can see the symptoms dissipate, basically within minutes. And that's something that's good to know, because then it'll give you an idea of whether maybe this may be something that you might want to look into more. You may want to look into they produce an orthotic that you wear, or a oral piece that you wear daily, which adjusts your jaw joint spacing, that alleviates the pressure on that nerve, so that your symptoms will continue to be suppressed during the day. So that's just something to keep in mind as well too, when you're considering looking into that. If you go to, I did look up Dr. Gary Demergen's website, and it's actually, let me see if I can just pull it up real quick, because I looked it up. It's I think it's tmjconnection.com. Let me just make sure that way we can get that out there, because you will find that he has videos on YouTube that shows him doing this kind of test on other people, and just to see the symptoms dissipate in front of you, to see, and that's kind of interesting, and at least gives you an idea whether it works for you or not. You have any comments with that, Ken, while I look this up?
Yeah, it's we've seen what they do. I was busy typing something, so I may not have caught everything you said there.
Well, his okay. So his website for Gary Demergen is tmjconnection.com, and there you go. Thank you.
Yeah,
actually,
right.
Barbara Kimmel actually sent it to me, and I appreciate that. Thank you.
It's in the chat line too.
Yeah, it's on the chat line as well too. So you can take a look at that, and they do have YouTube videos online that you can take a look and see how that affects people who react well to it. And because it is something that is you're investing into it. It'd be nice to see that is the type of treatment that would work for you. Let me see. Do we have any other questions?
Yeah, I have a response to Stacy, who pointed out she had a history of nosebleeds, and she had a treatment from an ENT which cauterized the bleeding vessel in the nose. She was wondering if could there be any connection to ST? My question to Stacy is, did your ST develop before or after the nosebleed treatment? Can you type something in somewhere and let me know?
Said both come and go in intensity.
Well, and what I want to know is, did the ST, is it possible that your ST developed as a result of the cauterizing your nose? Or did you have No, it didn't. So you had it before, so you had the ST before you had the nose treatment. Is that correct? Yeah, okay.
Yes.
Yeah, in that case, it probably didn't cause your ST. And did it make it worse, or any idea whether it made it worse or not? Yeah, swelling in the nose caused. Yeah, I'm not a yeah. I'd leave that to an ear, nose, throat specialist to answer that. I don't know enough about that.
Okay. Do we have any more questions for Ken? If you do come up with questions, like we said, you can definitely email Ken at kprice4000@aol.com. You can also email the NSTA at info@torticollis.org. I made the changes there too. And so, yes, sometimes the things come to mind later on. Let it percolate, and feel free to contact our organization, contact Ken. Ken has always been very, open to discussing his experience, and we really would love to find more people who have this kind of the same characteristics. That way we can group them together and hopefully have have medical professionals take a look at this anomaly. We need to find ways of getting more interest in finding out what the initial cause of this movement disorder is. So we do have a question from Helen Bartuska, and she's asking, is there any connections to hand tremors? I think she's asking.
Yeah. Right. I see the question. That if it's related to the ST, I suppose yes, it could. I've known many people. I think we've seen many people here at NSTA who have tremors in addition to the ST or tremors along with the ST. So that's not an unusual situation to have hand tremors along with ST. So there probably is some connection at some level. Whether the same phenomena that creates the ST is also causing the hand tremors, I don't think I have anything intelligent to say about that. It gets so deep into the neurology. I don't know.
Well, it's very true from the information that we've learned from movement disorder specialists. It's not uncommon for people with cervical dystonia to have other forms of dystonia or to develop other forms of dystonia. Like you can have cervical dystonia and spasmodic dysphonia, or even some kind of truncal dystonia. Sometimes you can have tremors as well too. There's a lot that's linked in regards to this, and a lot more that we need to figure out. And I wish I could give you a definite for sure answer, but I know that there is definitely some kind of relation in regards to both hand tremors and other terms of dystonia being together. Do we have any other questions? I think that would conclude our webinar for today. And I'd like to thank you again for attending. And if you do have more questions, I do agree. I do ask you to email Ken, email us. If you have suggestions for topics you would like for further webinars, please let us know. I'd like to let you know that we have in March, I have already talked to Dr. Brian Berman from VCU, and he's already going to be hosting a webinar on, let me just double check. His webinar will be on Saturday, March 26th. It'll be at 10 a.m. Pacific time, and his topic will be beneath the surface, non-motor symptoms in cervical dystonia. So that would be a really great webinar to participate in and to listen to. I hope you'll join us, as we will be placing this webinar on our YouTube channel shortly after I do some editing, and that we can review it again, and you may come up with more questions. Please, like I said, please do contact us. I thank Ken, I thank you for all the time that you've put together to place this presentation together, to share your experience. I hope that with the information we provided, that you guys would maybe be able to see similarities, maybe know somebody in the dystonia community that please spread the word, let everyone know that, in the community that we're doing these webinars, and I hope that everyone takes advantage of it. With that being said, thank you, Ken. I'd like to thank everyone for attending. I hope you all have a wonderful weekend. And remember, we're just an email away. Just give us a call. And thank you. And V thanks you as well. She's also here as well, the silent one on the side. Take care, guys.
All right. Great having all you guys join us today. Terrific. One more raised hand here.
Oh, wait, okay.
Thank you. Yes. All right.
We appreciate it.
Yeah, thank you.
All right. Take care, guys.
All right.